Embarking on the journey of in vitro fertilization, or IVF, is a significant decision filled with hope, anticipation, and honestly, a lot of questions. For so many individuals and couples, it represents a powerful pathway to parenthood when other avenues have been challenging. Simply put, IVF is a medical process where an egg is combined with sperm outside the body in a specialized laboratory. This process allows fertilization to happen under carefully controlled conditions. Once a healthy embryo develops from this union, it is then gently transferred into the uterus, with the ultimate hope that it will implant and grow into a successful pregnancy. This remarkable technology has helped millions of families around the world realize their dreams. The reasons for turning to IVF are as diverse and unique as the people who choose it. For some, it may be due to issues like blocked fallopian tubes, which prevent the egg and sperm from meeting naturally. Others might face challenges related to ovulation disorders, male factor infertility, or unexplained infertility, where a specific cause cannot be identified despite thorough testing. Age can also play a role as fertility naturally declines over time. Whatever your personal reason, know that you are not alone in this journey. Choosing IVF is a proactive and courageous step, a testament to your deep desire to build a family and your willingness to explore the incredible options that modern medicine offers. Understanding this process is the first and perhaps most empowering step you can take. It's about more than just the science. It's about taking control of your health and your future. As you begin, it's completely normal to feel a mix of emotions: excitement, nervousness, and maybe even a little bit of overwhelm. My goal today is to help demystify the preparation phase, breaking it down into manageable steps. Think of this as your guide, a trusted resource to help you navigate the path ahead with confidence. By preparing your body, mind, and spirit, you are creating the best possible foundation for the journey to come, and that in itself is a monumental achievement. Before diving into the specifics of medical tests and lifestyle changes, take a moment to acknowledge the strength it took to get to this point. The path to fertility treatment is often paved with patience and resilience. You have already demonstrated incredible determination. Now, we will channel that energy into practical preparation. This guide will walk you through everything from what to put on your plate to the important questions you should be asking your medical team. Let's equip you with the knowledge and tools you need to feel informed, supported, and ready for what lies ahead. Remember, preparation is not just about ticking boxes. It's about nurturing your whole self for the best possible outcome. When preparing for IVF, think of your body as the foundation you are building for a potential pregnancy. What you eat plays a crucial role in creating a healthy, receptive environment. You don't need a perfect diet, but focusing on whole, nutrient-dense foods can make a real difference. Aim for a balanced plate filled with colorful fruits and vegetables, which are packed with antioxidants that protect your cells, including your eggs and sperm. Incorporate lean proteins like chicken, fish, and beans, along with healthy fats found in avocados, nuts, and olive oil. It's also wise to reduce your intake of processed foods, excessive sugar, and refined carbohydrates, as these can contribute to inflammation in the body. Regular, gentle exercise is another key component of physical preparation for IVF. The goal here is not to train for a marathon, but to promote good circulation, reduce stress, and maintain a healthy weight. Activities like walking, swimming, prenatal yoga, or light cycling are excellent choices. These forms of movement help improve blood flow to the reproductive organs and release endorphins, which are your body's natural mood elevators. It's important to listen to your body and avoid overly strenuous or high-impact workouts, especially as you get closer to your treatment cycle. Consistency is more important than intensity. Even a 30-minute walk each day can have significant benefits for both your physical and mental state. Quality sleep is often an overlooked yet absolutely vital aspect of fertility wellness. Your body does its most important repair work while you are resting, including regulating the hormones that are essential for reproduction. Aim for 7 to 9 hours of uninterrupted sleep per night. To improve your sleep hygiene, try to establish a consistent bedtime and wake-up time, even on weekends. Create a relaxing pre-sleep routine, such as taking a warm bath, reading a book, or practicing deep breathing exercises. It's also important to minimize exposure to blue light from screens like phones and tablets for at least an hour before you turn in for the night. Finally, let's talk about lifestyle habits that you should consider limiting or eliminating. it's highly recommended to stop smoking and reduce or cut out alcohol consumption, as both have been clearly shown to negatively impact fertility in both men and women. They can affect egg and sperm quality and reduce the chances of IVF success. Similarly, it's a good idea to cut back on caffeine. While a small cup of coffee is generally considered okay, excessive caffeine intake has been linked to potential fertility issues. Making these adjustments is a powerful way to show commitment to your health and give your body the very best chance to respond well to the upcoming treatment. The medical preparation for IVF is a carefully orchestrated process designed to give your clinical team a complete picture of your health. This phase begins with a series of diagnostic tests for both partners. For the person carrying the pregnancy, this typically includes blood tests to check hormone levels like AMH, anti-Müllerian hormone, to assess ovarian reserve, and a transvaginal ultrasound to examine the uterus and ovaries. For the partner providing sperm, a semen analysis is a standard procedure to evaluate sperm count, motility, and morphology. These initial tests are not just hurdles to clear. They provide the essential information your doctor needs to create a personalized treatment plan tailored specifically to your body's needs. Once your tests are complete, your doctor will map out a treatment timeline. This calendar will become your roadmap for the weeks ahead, detailing medication schedules, appointments for monitoring, and key dates for procedures like the egg retrieval and embryo transfer. It can feel like a lot to keep track of, so I always recommend getting a dedicated calendar or using a planner to mark everything down. You will be prescribed fertility medications, often in the form of injections, which are designed to stimulate your ovaries to produce multiple mature eggs. It's completely normal to feel apprehensive about injections, but your clinic's nursing staff will provide thorough instructions and support to make you feel comfortable and confident. A key part of the medical journey is asking questions and being an active participant in your own care. Your fertility clinic is your partner in this process, so never hesitate to ask for clarification. Some important questions to consider asking your doctor include media group, patient holding notepad with questions, handwriting a list of questions in notebook @stock @distribute_equally. Based on my test results, what is our personalized protocol and why did you choose it? What are the potential side effects of the medications I will be taking? What is the clinic's success rate for patients with a similar profile to mine? Who is my main point of contact at the clinic if I have questions after hours? Being informed helps reduce anxiety and empowers you to be a true advocate for your health. Remember that this phase requires teamwork, both with your medical providers and with your partner. If you have a partner, attend appointments together whenever possible. This ensures you both hear the information firsthand and can support each other in processing it. Managing the logistics of medications and appointments can be a shared responsibility, which can help lighten the load. Your medical team, from the doctors and nurses to the embryologists, are all working together with one common goal. Media group, diverse medical team in clinic hallway, doctors, nurses, and lab techs in group meeting, @stock @distribute_equally, to help you build your family. Trust in their expertise, follow their guidance closely, and know that you have a dedicated team supporting you every step of the way. The IVF journey is as much an emotional marathon as it is a physical one. Preparing your heart and mind is just as critical as preparing your body. It is completely normal to experience a wide spectrum of feelings, from intense hope and excitement to anxiety, frustration, and moments of doubt. Acknowledge that these emotions are a valid part of the process. One of the most effective ways to manage this emotional roller coaster is through stress reduction techniques. Simple practices like mindfulness meditation, journaling your thoughts and feelings, or deep breathing exercises can be incredibly grounding. Even taking just 5 minutes each day to sit quietly and focus on your breath can help calm your nervous system. Building a strong support system is absolutely essential. Decide ahead of time who you want to share your journey with. You may choose to confide in a small circle of trusted friends or family members who you know will offer unconditional, non-judgmental support. Beyond your personal circle, consider connecting with a professional counselor who specializes in fertility. These experts can provide you with coping strategies and a safe space to navigate the unique emotional challenges of IVF. Many clinics also offer support groups where you can connect with other individuals and couples who truly understand what you are going through, which can be an invaluable source of comfort and camaraderie. For couples, this journey can either strain a relationship or strengthen it in profound ways. Proactive communication is the key to navigating it together. Make a pact to be open and honest with each other about your feelings, fears, and hopes. Remember that you may process emotions differently, and that's okay. Be patient and compassionate with one another. Plan non-IVF related activities to ensure your relationship continues to be about more than just fertility treatments. Go on date nights, take walks together, or work on a hobby you both enjoy. This intentional effort to connect will reinforce your bond and remind you that you are a team facing this challenge together. As you stand at the beginning of this path, please hold on to hope. While there are no guarantees with IVF, thorough preparation can make the journey smoother and give you a sense of control in a process that can often feel unpredictable. You are doing everything you can to create the best possible circumstances for success. You are strong, you are resilient, and you have taken a brave and powerful step toward your dream of parenthood. Trust in the process, lean on your support system, and be incredibly kind to yourself along the way. Your journey is unique, and you are ready for it.